the provider has determined that there is a cancerous tissue that needs to be excised. So the patient is scheduled for a excision procedure of the breast, which is called a mastectomy. Okay. So mastectomy, when you do for a gynecomastia, meaning enlargement of a male's breast. So please understand, this code should be reported only when the gender is male. It is not reported for the female patients. Gynecomastia is an abnormality of a male patient. Fine. So when mastectomy is done for a male patient, you can go with 19300. So we also have partial. Partial meaning along with the mass, the provider is also removing the normal margins. So if that goes for a qualifies for a lumpectomy or a mastectomy, then it is a complete mastectomy. They are going to remove the skin, nipple and the entire subcutaneous tissue. Coming to a radical, so usually this is performed for cancers, breast cancers. And you know, there are many sufferers of breast cancer in the US, in the Western countries, right? It is pretty common. They resort to something called as a radical mastectomy. In a radical mastectomy, what happens is they are going to remove it from the root, radix. Radices, radical meaning radices, radices meaning root. So from the root, from the base, they are going to remove the tumor. Whenever they are going to perform a radical mastectomy, not only the breast tissue, what happens in a cancer, not just the organ, the adjacent lymph nodes are affected, the sentinel lymph nodes are affected, right? The regional lymph nodes are affected. So with the breast, we have the regional lymph nodes as axillary lymph nodes. And of course, the internal mammary lymph nodes. They will be removing a part of the affected lymph nodes or the entire axillary lymph nodes. Okay, when they remove these lymph nodes along with the breast, this qualifies for a radical mastectomy. So we have three different codes for this radical mastectomy: 305, 306, 307. 307 is called a MRM, modified radical mastectomy. Think of breast. You should also think of a muscle called as a pectoralis muscle. It is in two parts as pectoralis major and pectoralis minor. In 19307, pectoralis major is kept intact. It is not dissected. They are removing the breast, the axillary lymph nodes and the pectoralis minor. In 19306 also it is a radical mastectomy where they are excluding the pectoral muscles but they are removing the internal mammary lymph nodes. In 19305, it is a radical mastectomy where they are removing entirely the pectoralis muscles plus the pectoralis muscle plus the lymph nodes.